Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. There's been one probable case that has now been ruled as negative. So our total number of cases is now 283. 5 individuals are currently hospitalized, and there are none of those are in intensive care. 243 individuals are listed as recovered. There are 33 active cases. Yesterday, 527 lab tests were performed. This brings the total to date to 28,810. I want to comment further on the cluster in the workplace identified yesterday in Prairie Mountain Health. Current case count is still 7, but with further public health investigation, it's felt that that number could have been higher, but for some of the precautions that that workplace took. On advice early on to businesses, this business took it upon themselves to cohort their employees, to group employees in smaller groups and contain them in those groups while they work. This limits the amount of contacts. And through the public health investigation, all of the cases were connected to that one cohort. No employees outside of that cohort have tested positive. So it's a real note to the actions taken by this business, the actions that can be taken by any business to reduce the impacts of this virus. And so, so again, with workplaces, the basics are important, that there needs to be policies in place to ensure that ill people aren't showing up to work, that people who develop symptoms while at work can leave. Lots of hand washing is quite important. And then again, in large workplaces where social distancing may not be always feasible, then things like cohorting employees is another good strategy to limit potential contacts should a case arise. And so we've certainly increased our capacity to testing. We've increased the criteria to be tested. So any symptomatic Manitoban and a Manitoban with respiratory symptoms can certainly be tested for COVID-19. The most important thing is people with respiratory symptoms cannot be attending work or school, cannot be out in public. Should really stay home with mild symptoms, can call HealthLinks if you need advice, and certainly for all issues related to your health, keep in contact with your healthcare provider. Our healthcare services are safe. Our hospitals are safe to attend should you need, and certainly keep in touch with your physician and healthcare provider to not fall back on your healthcare needs. There's been some questions about previous cases of pneumonia and whether there's been any testing done on prior cases. And so even prior to our first case of COVID-19 here, severe respiratory cases that were admitted to the ICU dating back to December, we had samples available on 18 such cases. All of them tested negative for COVID-19. There's also been a lot of talk about the information sharing agreement that we have with First Nation communities. This agreement was the first of its kind in Canada, and we're working on a similar agreement with Inuit communities. We remain interested in connecting with representatives from the Métis community to work on a similar agreement, but in the meantime there'd be no plans to release such data unless a formal agreement was in place. And so our numbers, our flattened curve that Manitobans had worked so hard to achieve has put us in a position to now gradually reopen some of our economy, and the key to that is gradual and cautious. We cannot open everything at once, so we made a informed decision on what businesses, what services can reopen at this point. We're going to follow those numbers very closely and look to loosen those restrictions further at appropriate times, but we have to start slow, and this is not a return to normal. We need Manitobans to still be aware of this virus. We still have this virus circulating in our communities. Physical distancing is important whenever we can. Staying home when you're ill is vital to this. If you have respiratory symptoms, you cannot be showing up to work, even with mild symptoms. Mother's Day is fast approaching, but we're still dealing with this virus. So we are suggesting against large family gatherings at this point. Certainly if you're getting together with family, it's ideal to do so outside. And it's also ideal to do whatever you can to maintain that physical distancing. And certainly the rule applies again, even those with mild respiratory symptoms should not be attending gatherings at all. So if you can meet virtually, even better. If you meet outside, physical distancing is important, and no one ill showing up for any gatherings is vital. And we recall too that those at increased risk of the severe outcomes of this virus are those over age 65, those with underlying medical conditions, and those with immune compromise. So those individuals and their loved ones need to be extra cautious because, like we said, we're not returning to normal. We still need to protect those most vulnerable. And so Manitobans are well aware of the ways to protect themselves and others, frequent hand washing, stay home when you're ill, maintaining physical distancing, and calling health links should a need arise if you have symptoms. Businesses that have questions regarding the orders can contact engagemb.ca for further information, and we suggest all Manitobans stay up to date with COVID-19 by visiting manitoba.ca/COVID-19. So thank you again for everyone's hard work on this, and I'll pass it over to Lanette.
Thank you. Good afternoon. I'm Lanette Siragusa from Shared Health, and I wanted to begin today by acknowledging the work of staff at our personal care homes who are going above and beyond the call of duty to care and comfort the residents that they see every day. And we know that the visitor restrictions that have been put in place at the long-term care facilities especially has been really tough on residents and their loved ones. And for residents, that feeling of disconnection from their family can be particularly difficult to endure. And we have heard just the most wonderful stories from across the province about staff who are taking the initiative to fill some of that void when they can. And last week I heard the story about the staff at Valley View Care Center in Brandon. Their executive director, Connie Cron, and her team spent 12 hours providing haircuts and hair sets for any resident who wanted it at their facility. Connie's not a hairstylist, but she is a good Samaritan, and it's a wonderful act of kindness for the residents who haven't been able to get out and have a haircut for a couple of months. So thank you, Connie and the team, for leading by example and for thinking of ways to make life a little bit more normal for our residents during this unusual time. I wanted to give you an update about surgery and diagnostics procedures. So the health and safety of our clinical providers has always been a top priority for us as we're planning and trying to respond to this COVID-19 virus. Also, though, it's obviously our responsibility to ensure that ongoing services are provided to patients from across the province. Over the past 8 weeks, we have limited surgeries, procedures, diagnostic, and lab activities. Urgent, emergent, and trauma cases continue to be performed, including cardiac, trauma, cancer cases, and other urgent types of procedures. The decision to limit that activity at the time was the right decision to make, as we were making every effort to limit the spread of the virus. But there obviously is an impact, and it is significant. So across the province, between March 23rd and the end of April, approximately 3,000 surgeries were completed, which represents about a third of what we would normally do during that time, and that's comparing to last year's statistics. We have seen a similar impact in diagnostics, which includes postponement of ultrasounds, MRIs, and CT scans for non-urgent situations. But just because these are not urgent situations does not mean that they are not necessary situations. So we have said repeatedly that we would continue to evaluate our ability to increase clinical activity, and that we have to balance the needs of Manitoba patients with our efforts to continue preventing the spread of this virus. So while we continue to plan for the potential surges of COVID, we are also developing operational protocols that will allow us to continue to deliver the care in this new normal state. So here's what that means. Across the province, clinical activity is being carefully ramped up. Patients will be scheduled according to clinical priority to receive the care that they need. Additional operating room days will be added at at most sites in all regions, according to need, priority, staffing, and available PPE. Surgery beds will once again be utilized for their intended purposes, which is post-op surgical patients. And our experience in winding down surgery in March when we were preparing for COVID has demonstrated to us that if the need becomes apparent and we have a surge in COVID patients and we need extra inpatient capacity, it really is only a matter of days and we can free up those surgical beds if we need to. So for now, we're carrying on. We're going to use those beds for surgery. Medicine beds will similarly not be held open in case of a surge, but will be managed if and when a surge occurs. So our admissions and our length of stay in the medicine beds remains low. We'll continue to monitor, and we are very confident in our ability that we can adapt quickly to a change in demand in response to the virus. Staff will also continually use the PPE appropriately, and our experts in infection prevention and control will continue to look at the latest evidence, consult with our clinical leaders, and guidelines will be updated as often as they are required. Appropriate use of PPE today will ensure our ability to provide necessary care to patients who rely on us in the coming weeks and months. So closely monitoring that surgical activity will also ensure there's continued availability of PPE for future surges of COVID-19 cases. It's a vital balance and one that we have to ensure that we continue to provide the services, but also keep a vigilant watch on that COVID activity in our province. So we will continue to learn, we will continue to evolve, and share updated advice with our staff and with our patients. And just wanted to give you an update on some of the statistics that we regularly report on. So HealthLinks in the past week received 8,475 calls, which is a 4.4% increase from the previous week. The average wait time varied from 2 to 6 minutes. Our online assessment tool has seen nearly 513,000 web views since it launched, and more than 50,000 views in the past 7 days. We mentioned earlier this week about the online portal, the patient portal, so that people could go online and confirm their negative test results on the Shared Health website. In the first 3 days of operations, 762 people have viewed their results on the portal. And we also launched that toll-free phone line for people to call and confirm their negative results, and 426 people received their results via this method in the first 3 days. And finally, DynaCare has been providing the call center for us in the past, and it wound down its services on Monday. And in total, they made 22,000 calls since launching March 27th. So we're very appreciative of the help that they provided to us. And as a reminder, public health officials will continue to call people directly if they are positive for COVID and provide support and direction as soon as possible. And with that, we will open the line to questions.
Thank you. A reminder to our reporters online, you will have one opening question and one follow-up question. Up first this afternoon from the Winnipeg Sun, Scott.
Scott Bilk here, Winnipeg Sun. Wondering what the fallout, if any, we've heard of postponing, I suppose it would be 6,000 surgeries.
What was the question, Scott? What's the fallout?
Yeah, if any, if you've only done 1/3 of what you would normally do, I think the math would be roughly 6,000 surgeries postponed. What is the impact of something like that?
Yeah, well, obviously, it's an inconvenience for sure, but you weigh that with the risk of having COVID in the beginning in our province. So there's an inconvenience, and it depends on what surgery's been delayed. If it's a surgery because of pain, that's significant. Hopefully people can manage pain through other alternative methods. Sometimes it can be more incapacitating, like cataract surgery, obviously, is a different struggle. It might not be pain, but it kind of changes how you live your life. So we appreciate that impacts people in different ways. But that having surgical slowdowns is actually something that we do during the year, usually not between March and April and May, but there is opportunity to increase the amount of surgeries. So often we do have a summer slowdown. And so we're looking at, is there opportunity to increase the volumes then and catch up so that we can address the wait list issues. So we'll have to take it slowly, but that would be the goal, is that certainly our surgery teams want to serve the patients who need surgeries and not delay them any longer. So it can vary, but I can assure the public that if there were surgeries that were life-threatening or urgent or would change the outcome of the trajectory of the disease process, those would have been done already. Those would have been prioritized.
Thanks. And my follow-up for Dr. Roussin. It's been reported that it was a trucking company involved in that outbreak, and obviously there's public orders that exclude truck drivers from crossing the border and self-isolating. Would that change given what we know now, or is that something you're looking into?
Well, we're always looking at our interventions over time, and we know that those orders are in place because of the risk of importing the virus into the province. And so in this particular situation, no, that doesn't change our outlook on it, but we're constantly looking at that. And it's a balance, right? We talk about things like PPE, other supply chain issues, right? Well, that relies on the transportation industry. And so it's a balance. So we're aware of issues, but this particular cluster doesn't change our thoughts on that.
From CBC Radio Canada, Laisa.
Dr. Roussin, I would like to know, can you confirm that the cluster that we've been talking about since today is the truck company?
Yeah, so public health, we only list or would reveal the identity of a company or a location if we felt it was required to protect the health of the public. And this case here, we've investigated it thoroughly, and there's no benefit to announcing it to the public. And so that's where we're at.
And also, based on the fact that the Manitoba has reopened the economy, like it's starting to reopen the economy, and also in the U.S. we're talking about reopening economy. So truck drivers, they are going from here to there and coming back. Is there any other additional security measures that maybe the Manitoba government is thinking about, maybe some restrictions or some rules to follow?
Right. So, so typically the orders, the quarantine orders, as well as our orders regarding interprovincial travel, they exclude the transportation of goods and services, and for good reason, right? All the things that we're looking for, right? Personal protective equipment, supply chain issues, right? Our goods and services, right? So they rely on this. So we can't completely restrict that. So certainly these drivers need to be aware of limited interactions in places that have increased cases, and they're being vigilant to self-monitor for symptoms upon their return. And so there are precautions in place, but it's a balance. We have to maintain our supply chains to be able to function.
From CBC Manitoba, Aidan.
Hi, good afternoon. My question is, or Aidan from CBC News, my question is for Dr. Roussin. I'm wondering if you can share with us what the investigations have revealed so far about the latest two cases involved in the cluster that were announced yesterday, if they've spurred any additional investigations on top of that or more testing happening.
Yeah, I don't have anything more specific about those cases. Each case, all of our 283 cases, right? They're all treated that way. The case is identified and self-isolated, and then a very thorough contact investigation happens, and those contacts are investigated, and they are self-isolating. And so these investigations are no different than that.
Okay, and my follow-up is also for you, Dr. Roussin. I'm just wondering, we know that the cluster linked to a workplace. Are all 7 cases that have been confirmed, are all 7 cases employees of that workplace?
No, I believe 5 are, and then 2 are close contacts to those employees.
From the Canadian Press, Steve.
Dr. Roussin, Steve Lanette from the Canadian Press. Wondering if you could comment on how far along you are in terms of the contact tracing from the cluster.
Yeah, I mean, I don't have all that information. I mean, typically our contact tracing efforts are, are being completed within 28 or 24 to 48 hours on there. So I don't have details on every specific one. Like I said, the workplace investigation was made quite simple because of the company's decisions to cohort employees. So that the actual investigation within the company is quite simple because there's a limited number of contacts because of their good work. And then from there we would span out to close contacts, household contacts, look for other places they visited. So I don't have details on any of those cases.
Okay, and my other question is, are you coming up with any new or refined recommendations to employers, given that people can be asymptomatic and carry this, and that there might be some lag between somebody getting it and then showing symptoms, and during that time they might work?
Yeah, so, we certainly know as we learn more about this virus that we know there is documented pre-symptomatic and even asymptomatic transmission. It's still the predominant form of transmission of this virus is close, prolonged contact with a symptomatic individual. And so that's what's driving the epidemic. And so those are the key to limiting the amount of numbers of these cases, is that symptomatic people can't be in the workplace. Symptomatic people shouldn't be out shopping or visiting other people. So that's really the key. The asymptomatic is certainly there, but it's not the driving force. So the advice is what we are always talking about. It's hand hygiene, disinfecting surfaces, and physical distancing when at all possible. If that's not possible, then things like cohorting employees are important. Employees can consider wearing non-medical masks as an added benefit. Again, it's not a substitute to any of those other issues, but that's the kind of advice we've been providing employers.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. I have a question for Dr. Roussin about the pneumonia testing. Was that done retroactively, or was it done kind of as the cases came in as a part of the pandemic response?
No, it was retroactive. I think it took place at the near the beginning of March. They went retroactively to severe respiratory illnesses, admitted to ICU that they still had respiratory samples on. And I think the earliest cases dated back to December. And I believe there was 18 such cases that they could find that they still had samples there, and all of them came back as negative for COVID.
And further to that, will more retroactive testing be done, like expanding the criteria to do a retroactive test?
Well, I don't think there's any plans for that specifically. Remember, we have to identify the cases and still have samples available to test. I think that the idea of looking at what proportion of of Manitobans have been infected with COVID-19 is important, and we'll get that information once we're able to do a seroprevalence study, once we have some good tests for antibodies, which we don't have as of yet.
From City News, Stephanie.
Another discussion on with City News. Mr. Siragusa, yesterday you sent your book into how much the province has spent on PPE up to this point. Just wondering if we can get that number.
Yeah, I've been looking for that. Within the healthcare system, we have been purchasing PPE since, we always purchase PPE, but specifically for COVID-19 since January. But recently, central government has taken on a lot of that purchasing because it includes more than health. It includes families and justice. And so I haven't been able to access that end of the costing for it. So we'll continue to see what we can find. Obviously, it's in the millions.
Okay, thank you. And then BC is estimating it might take about 2 years to get back all the elective surgeries that they missed during this time. I'm just wondering if you can tell people how long they can expect to wait to make up their elective surgeries.
Mm-hmm. Well, you know what, we are looking short term. We're looking short term to schedule the surgeries. We're watching and waiting to see what happens with COVID. And we are looking ahead towards the summer where we typically would reduce our surgical activity, but instead the possibility of keeping it running so that we can address that potential backlog that's there of cases. So it's hard to say because it's actually a matter of people are booked based on priority of the situation. And it may change. What we hope to do may not be what we will get to do. So as soon as possible is really the short answer.
From the Winnipeg Free Press, Larry.
Yes, Dr. Roussin, Larry Bishop, Winnipeg Free Press. Notwithstanding what you told my colleague Steve Lambert earlier, I have a further question about the cluster cases at the Banner office of the trucking firm, and you were talking about, how you don't get as much information necessarily from, or there's not as much room for spreading the virus, if people are asymptomatic. But in a case where you've got a number of people working close together, and the employer is asked for testing of all people in the shift, and you have the testing capacity, why not test everybody in that shift and retest it given that people may become symptomatic or may you might get some false negative, but you might also later on, if you keep testing, get more information and help prevent a big cluster of cases.
Yeah. In fact, we did do that, Larry, in this case. So we tested, I believe, 14 asymptomatic people, and all those came back negative. But if they're close contacts, they'll still be required to self-isolate. So you're right. So asymptomatic testing, you have to be careful with it. We don't want to do it widespread, but in certain circumstances, like the one you mentioned here, where you're a close contact, we have an outbreak, it can be utilized, and we did in fact utilize it in this situation.
My follow-up is for Ms. Siragusa. We've heard a lot of the government say that there's that PPE costs may be $1 billion. You said a moment or two ago to a colleague that the spending so far has been in the millions. Can you say if the billion the $1 billion figure, is that kind of an outside or a worst case scenario figure as far as you know, and how did that figure come about? What was the genesis of that figure?
Mm-hmm. Well, I don't know the source of who threw out that figure. I think it would really depend. So this in this global pandemic, PPE is a hot commodity throughout the world, and I know that some of the PPE that we would normally pay for has gone up in cost, and the usage changes depending on evidence as it comes out or outbreaks as they occur, and so there's a lot of variables in that. And it also depends on how long this is going to last. If we have a vaccine in 9 or 12 months, that's different than if we have to learn to live with this forever or for a couple of years till we have some kind of herd immunity. So $1 billion, I think, probably is possible. We're not there yet. But certainly it could be possible depending on where this goes, yeah.
From Global, Will.
Hi there, everybody. Thank you for your time. My question has to do with prescription limits, and I understand the health minister is going to be addressing this tomorrow. But given that we've heard so many concerns about this since the pandemic started, I'm just wondering, why was this not addressed during the opening plan?
Yeah, I think that there's a number of issues to look at with it, and certainly it's been continually re-looked at throughout just like anything we're doing. So, I think that came up with a good strategy for it. The minister can discuss it tomorrow, but I think that's the timing is what it is. It's a different situation than simply than what the reopening is. And we've been, looking at it and reevaluating it, and tomorrow will be more information on it.
Okay, thank you for that. As my follow-up, I'm wondering, the prescription limit introduced to deter stockpiling of medications, obviously, was this at any time an issue? Did medical supplies ever run low?
Well, I think it was a preemptive issue. I think that as Canadians were introduced to the virus, we saw some evidence of hoarding of other type of supplies, and so this is really a preemptive measure to try to prevent that happening in prescription drugs. I'm not aware of any specific results of that, but that what it was a abundance of caution to prevent that from happening.
From the Brandon Sun, Bud.
Hello, Bud Roberts at the Brandon Sun. This is for Lanette. Lanette, you've spoken before about applauding groups that have put devices such as iPads and laptops into the hands of seniors isolated in care homes and how important that is, and it is, definitely. We've heard from some families in rural care homes saying there's a terrible lack of Wi-Fi or internet service, having a terrible time even connecting to the outside world. I was wondering if Shared Health is aware of this, and if you are, have you had any opportunity to work with rural regional health agencies to look into that?
Yeah, thank you for asking, Bud. So as part of the provincial clinical and preventive planning that was underway for the past couple of years, it absolutely was identified that we need to invest more in rural and northern Manitoba internet access. It's actually a part of our strategy going forward. So yeah, it's unfortunate that that is a barrier for some of our families right now, and hopefully that will be short-lived and something that we can look forward to improving in the future.
Okay, thank you. And as a follow-up, just Dr. Roussin, this is more or less a general question. It's close to a week now since phase 1 loosening a bit. From what you've seen so far, are you happy with what's happening? Are there any areas where you still have concerns that people are maybe embracing a little too liberally?
Not that I've been aware of. I think that Manitobans have been dealing with this virus for quite some time. They understand that they're going to be dealing with it for the foreseeable future. I think the restrictions that we had in place were definitely needed. They've put us in this place, but they were restrictive. So I think Manitobans are happy to see some of these restrictions being loosened, and Manitobans are smart. They know how important this is. So from the reports I've been receiving, the vast majority of Manitobans are doing this cautiously, and we really are going to follow these numbers quite closely.
From CJOB, Clay.
Yeah, hi. Siragusa, do you know approximately how many people would be in hospital right now? Victoria, Seven Oaks, Concordia, roundabout figure on community hospitals. And are there many beds that are not being filled right now? And do you happen to have those numbers?
I do have them. I have to look it up, but it is a couple of hundred province-wide. We have beds available, so that includes surgery, medicine, and intensive care. So we're still at about 70 to 80% occupied, which means there's a lot of vacant beds there. So as the surgery procedures start increasing and some of the clinical activity, the ambulatory clinics start opening, we can expect those beds to start filling up, and that's okay. But if we see a COVID surge, we will adjust our strategy accordingly. And I'm going to look up those numbers for you, Clay, and I'll get back to you momentarily.
All right, thank you for that. Just a quick follow-up. Dr. Roussin, any advice, because we are hearing there are some people who are still apprehensive about going to see their family doctor and sitting in a waiting room. Do you have any advice for those people?
Yeah, so I mean, you can't let your health needs get behind you here. There's more to our health than this virus, and our healthcare facilities have taken a lot of precautions, and so I'd say they're safe. I'd say call your family physician. There's a lot of opportunity now for virtual care. But sometimes virtual care isn't sufficient, and so speak to your family doc, get in for an appointment if necessary. But it's safe. We need to take care of all of our health. We need to be aware of this virus, but please don't let your healthcare needs fall behind.
Thank you. We have a few moments left. If any reporters have a couple more questions, please proceed.
Dr. Roussin, it's Larry Cush at the Winnipeg Free Press. You said a moment ago that you had tested a number of people who are asymptomatic in Brandon at the trucking firm. I was wondering, is that the first time that the province has tested asymptomatic people at a particular workplace or at any place?
Yeah, I think it has been. We've tested a number of asymptomatic people in the past, and it was just sort of people that showed up for testing that just weren't were tested anyways. So we've had a number of asymptomatic people tested all along, but this was the first planned outbreak investigation in a closed space like this that we actually decided to test an entire group of asymptomatic people.
Are you optimistic that this cluster will not increase in size?
Well, what we're the case investigation was done quickly. The contact investigation was done quickly. So remember, the incubation period is 14 days. So everyone who's a contact and everyone who tested negative, we still have a number of days left for this virus to incubate. But what we do know is that those people, if they do turn positive, they've been self-isolating. So their number of contacts should be quite small. So that's the whole purpose of these contact investigations. So certainly we might see more cases. But it's unlikely to see a lot of contacts generated from those cases because people are self-isolated so quickly.
Dr. Roussin, Will here from Global. I'd like to ask, we learned of a rally potentially planned for this Saturday. Apparently people protesting a lot of the public health orders that have been issued. I won't go through all the grievances here, but they say things like social distancing is actually counterproductive to the development of our natural immune system, and that the outlook for the fatalities surrounding COVID-19 are actually a lot lower than originally predicted. Could you just address some of these people's concerns and see whether or not going to a rally on Saturday is a good idea?
Yeah, so I would definitely advise against large groups. So certainly people should voice their concerns, and that's what we're here for, and we can respond to that. Certainly avoid large groups, even outdoors. And so, so what I would say is that if you take a look at many jurisdictions around the world, jurisdictions that were able to act quickly to implement these type of restrictions, you can see evidenced in their numbers. Fewer cases, fewer deaths, and Manitoba is one of them, that we were fortunate enough in the timing to be able to get ahead of this. When people talk about things like immunity and herd immunity, remember for a virus that has an R0 of about 2.5 or so, herd immunity doesn't really kick in until about 60% of your population has been immune. And so if we look at 2 to 3% of the cases have severe outcomes, that's a lot of severe outcomes. So at this point here, we're not relying on herd immunity. We're trying to protect those most vulnerable. Manitoba was one of the last provinces that needed to have strict measures in place. And we have been, because of Manitobans' efforts, we're one of the first to be able to loosen those restrictions. So I think we've put ourselves in a good position. We're reopening our economy quite a bit earlier than other jurisdictions are able to. So, so I certainly hear people's concerns there. They were restrictive measures, but they were required, and because of them, we're now able to reopen our economy at a safe time.
Hi, Aidan from CBC News. I have a question for Dr. Roussin. In regards to clusters or cases that may take place in workplaces that have operations in multiple provinces, I'm just wondering how information sharing works between provincial governments.
Yeah, that's right. It's a great question, and it's not unique to COVID. We often have case investigations for many type of communicable diseases that pass borders, even international borders. So we have things in process with our surveillance and epidemiology department to pass contact information and case information on to other jurisdictions so that they can complete a case investigation if necessary in their area or follow up on any cases or contacts. So yeah, so we definitely do that for COVID-19, but we do it for many communicable diseases.
Thank you. And this concludes today's media briefing.